Dear students, with this lecture, you start a new era in your anatomy studies. Up to this point, you studied the framework of human body, the bones and the joints. Now we start introducing the rest of the structures. The human body is quite complicated. It contains not only bones, but also muscles, various structures. Structures is a kind of nickname for arteries, veins, lymphatic vessels, and nerves, and also different organs. And the surface also has some kind of anatomical terminology. In this lecture, I introduce you to studying all of these components of the human body. The only way you can really become familiar with the structure of the human body is to dissect it, to have a personal impression on these structures. For that, we need dissection. Dissecting was prohibited for centuries for the religious region, and it was very difficult to find appropriate data on the human body for the medical doctors. In this area, the closest was the Egypt, in where also in a religious region, the embalming necessitate to remove from the body the easily rotting soft tissues, and during this process they get a lot of anatomical knowledge on that. Even more in Europe, where the dissection was forbidden, the doctors went for a study trip to Egypt to study their anatomy, including the big Greek doctors. In Europe, in the 16th century was the first step of the organized anatomical training. The way we study the human body is, because of this complexity, to divide into areas. This is what we name the regions. By regions, we will study the areas of the body, from the skin all the way down to the bone, every tissue with the appropriate relations. The regions, the borderlines of the regions, has only anatomical significance, but without that, we cannot really didactically teach anatomy. Now let's see what kind of structures are in the human body beside the bones, and I give you a kind of introduction in this and the next lecture, how to recognize them and how to make a good use of them. So what kind of dissecting steps we have? First of all, the first thing we meet is the skin. The skin, on the skin we will describe the area where we will dissect, the region. For that we need palpable structures, bony pieces which you felt through the skin, and this is what you studied during your bone and joint studies. When we remove the skin, we find structures between the skin and the underlying fascia, and these are the so-called superficial structures. Superficial structures are superficial veins, practically no arteries. We have skin nerves, and in certain area, especially on the face, we have skin muscles. It's a very good idea that we imagine or even drawing the possibility of the superficial structures, because they are very delicate, very sensitive. The removal of the skin is technically not really easy, and just to protect this area, you have to get a knowledge. You have to get an area where we can express these structures. The superficial structures are medically important, since most of the injuries and most of the problems of the patients comes with a superficial structure, very little the deep one, and also medical diagnosis and therapy, intravenous injection, blood samples, and so on, also dealing with the superficial structure. So this is one we have a special important on that. The next layer is a white, glossy, very thin connective tissue, what we name fascia. Here we have the fascia. In this area, identical area, the fascia is after removal. The fascias has both anatomical and medical significance. The anatomical significance is that the various parts of the fascia make compartments, sub-areas, sub-regions in a region. This is why it's important when we want to describe the region. The medical significance is that even although it's very thin connective tissue, but very efficiently prevents bacterial penetration. So if you have a bacterial infection, it runs along the fascia, but has difficulties to pass through, and using this knowledge we can foretell where and when the bacterial infection will forward. The fascia has the following components. One lamina which takes all around the structure. This is the so-called superficial lamina. This is what is just below the skin, and only the superficial structures are between that and the skin. Also, we might have in a certain area deep lamina. Usually it bridges the gap between two superficial laminas, and the significance of that, it separates muscles, usually a superficial group of muscles and a deep group of muscles. Another derivatives comes from the superficial fascia to the bone below that. This is what we named septum. This septum also separates muscle groups, it provides borderlines between the various compartments. Also, the superficial and also deep fascia sometimes has doublets, forming canals. In canals, the structures pass in a relatively protected region. One more thing is very similar to that, but not fascia, is the interosseous membrane. This connective tissue is stretched between two neighborhood bones and much thicker and much more durable than the fascia. Fascia is actually a wrapping material. This one behaves like a tendon. This is a place of origin muscles. This is what we name the interosseous membrane. Below the fascia, as I mentioned, we have muscle groups separated by muscular septum or deep laminas. The muscle group contains muscles, and between the muscles we have the so-called structure. Structure is an anatomical slang for vessels, arteries and veins, nerves, and also lymphatic vessels and lymph nodes. So if you hear in anatomy this structure, this describes this series of components. Okay, now let's talk about the muscles. What is the basic knowledge on the muscles? The muscles has, first of all, a belly. Muscles always have a middle part, which is red, which is the active part, which is able to contract, and two ligament-like structure, what we name tendon. This is passively, it's actually really conducting the force from the muscle to the bone. The belly can be in different shape. Frequently its spindle shape looks like a mouse. This is why the Latin term for the muscle is musculus, which means little mouse. The muscles can be in certain area flat. In this flat muscle also have a flat tendon, and this is named aponeurosis. This is not to be mixed with fascia because it's conducting force. So this is a flat tendon. Fascia, as I mentioned, is just a kind of wrapping material. The muscles can have two heads or more heads. What does it mean? The muscles originate from different area. For a while it has two bellies, then the bellies unite and has a common tendon on the other end. This is what we named two-headed or three-headed or four-headed muscle, depending on the muscle. Also it's possible that we have multi-bellies. It means that we have a muscle fibers, a tendinous interruption, and the muscle fibers interruption, and so on. This is what we name the multi-belly muscles. This allows a segmental contraction. As you know, the muscle fibers are a single muscle fiber from tendon to other tendon. It's not interrupted. A muscle fiber can contract all, either the entire muscle fiber or nothing. Consequently, it is not possible to contract one part of the muscle or other part of muscle. If it's necessary, for instance, in the abdomen, just to protect from stretching the sensitive internal organs, we have interruptions. In this case, various segments of the muscles can be innervated differently and can contract differently. This is what is very useful for whenever we make excess movement to protect the internal sensitive organs. Also, human beings abuse these things. Both genders impress the other one with this one. The ladies, it's possible to make little circles with the belly button. This is what the belly dancers using for amusing men. The men also amuse women, so the six-pack belly, which also an enlargement of these bellies of the rectus abdominis. The tendon originates from the bone in a very tricky way. As is described in the histology lectures about the bone, they have a so-called Sharpe fibers. Sharpe fibers is not a single fiber, but a principle describing that the connective tissue fibers, which are deeply embedded in the bone, and actually collagen fibers, whenever they reach the surface, uninterrupted, they continues the collagen fibers with any attached structures like ligaments or tendons, and this is why we cannot easily tear off the ligaments and the tendons from the bone. Whenever we overstretching a tendon or a ligament, usually either the ligament or tendon breaks in the middle or breaks a piece out of the bone, but virtually never separates the bone from the ligament or the tendon. You have to be familiar also a pair of terms, origin and insertion. And this simply means the 2 points where the muscles is contracted to the bone via the tendons. One end is named the origin, the other end attachment point is named the insertion. Traditionally, whatever end is closer to the midline of the body or the limbs, closer to the origin of the limbs, we named origin, and the opposite end named insertion. In most of the muscle, where is the origin and insertion is quite obvious. Sometimes when the muscle is just across, we cannot really determine. In this case, we say one end and other end, but it's very rare. The muscle fibers, as I mentioned, the working part of the muscles can stretch in various different sizes from 1 millimeter, which is the stapedius muscle in the middle ear, till 70 centimeter long, like the sartorius muscle. The muscle fibers can run different way. Most of the muscles have parallel running muscle fibers. So in the one end we have a shorter or longer tendon, then parallel all the muscle fibers running parallel till the opposite tendons. It is possible that the muscles obliquely attached to the tendon, and if you remember your physical studies, whenever this muscle contracts, it's much more forceful because much larger quantities of muscle fibers, much larger the cross section of the muscle fibers than the tendon itself, but the extent of the contraction is shorter. This is one usually using for the remote controlled fingers. Also, it's possible this is bipinnate muscle when we have a tendon and this is not visible because the muscle fibers cover it, and from that two sides the muscle fibers run. This looks like a feather. Penna is actually Latin for feather, and this is really looks like the feather. Other fingers, other muscles in the hand also can be unipinnate. Functions. The muscle cannot do anything else just to contract. If you want to analyze the function of the muscle, you have to watch the 2 points, the origin and the insertion, and try to move them closer to each other, and this is what the muscle does. The only function is to contract. The contraction can be passive. It means that this muscle is working hard just to keep this weight in place against the gravity. So when there is no movement, but there is a very strong muscle function, this is what we name the passive muscular function. This is for stabilizing things. The active makes a real movement in a joint, and this is what we see as movement. Whenever we describe this kind of movement, we have to mention the axis, as we'll mention a little bit later on. When you really want to study the function of the muscle, you can make a very nice model in the dissecting room. All of the skeletons, the joints, are manufactured in a way that most of the joint movement is possible on that. If you are careful not to break this skeleton, you can model the muscles. For instance, this is the short head of the biceps from the coracoid process till the radius, and the 2 ends of the strings, which is actually show the muscle, is here. Whenever we move the skeleton and the spring becomes loose, it means that these 2 points getting closer to each other. So this is a movement in which the muscle is involved. If the stretching of the string doesn't change or become more stretched, it means that this muscle doesn't do that movement. So this way you can easily understand that especially a certain head of which muscle is what does it do? You need a good assembled skeleton, and also you need knowledge on the origin and the insertion of the muscle. Another pair of terms related to the muscle movements are synergist and antagonist. There are muscles, sometimes in different area, which does the same movement. For instance, a bending, flexion of the elbow joint is done by both the biceps and also the brachioradial muscle, because in this movement, these two muscles work together. This is what we named a synergistic muscle. On the other hand, for instance, the extensors of the thigh will make an extension of the knee joint. The flexors of the thigh makes a flexion. So they're working against each other. They're working opposite movement. These muscles named antagonists. It is possible that a pair of muscle in certain movement agonistic and other movement antagonistic, depending on what's the physical location of the muscle and from which direction they approximate the insertion and the origin point. Next thing what you have to know about the muscles, innervation. The muscles are controlled by nerves, and you're supposed to know which nerve controls which muscle, because it's very important, this piece of knowledge in the medical practice. We have a large number of muscles, never counted them, but close to 100. Consequently, you are supposed to memorize close to 100 nerves. The life is not that bad if you do it cleverly. One of the rules is that usually a muscle group, which may contain for 2 to up to 20 muscles, innervated by a same nerve, without any exception, or we have 1 or 2 exceptions. If you study that what is the nerve of that muscle group, and whether we have exception and which muscle are exceptions, it makes your life easier, because you have to study one piece of, actually 2 sets of information. Number 1, this particular muscle question belongs to which muscle group, what is the nerve of this muscle group, and whether this muscle belongs to the exception or just the general rule, and that's it. So in this case, it's much easier to memorize, to know the innervation of the muscles. Tendon sheaths. Tendon sheaths is a tunnel formed to let the tendons pass through. The main function of that is the reduction of friction, but also leading in a certain way the tendons. The structure is the following. Let's imagine a tube which is filled with a very viscous liquid, a kind of slippery liquid. Without breaking the membrane, it's actually a kind of synovial membrane, very similar to the capsule of the joint. We push in the tendons, and whenever the tendon moves, practically the inner side and the outer side moves against each other, and this oily, slippery fluid will let it easily to move without any friction. It's very important to understand the blood supply. The tendon never has an artery running along it, but various segments of the tendons get very tiny arteries. If you do a surgery around the tendon sheath, it is possible that breaks one of these tiny arteries. It has practically insignificant bleeding, so you may not notice it, but because a segment of the tendon will not get blood supply, in a few days it will die. And it looks like as if we cut a piece out of the rope, so it cannot function anymore. So be careful when you do any kind of surgery in nearby a tendon sheath. We have various tendon sheaths in the area. Here there is no time to describe everything in details. You will study in the dissecting room. Just a very short summary. In the hand, we have a complex tendon sheath system in the palm. Whatever is important is that we have a common tendon sheath of many structures here, including some arteries and veins. And this is communicating with the little finger and the thumb, but there is an interruption here. The significance of this piece of knowledge is that along the tendon sheaths, because the fluid is very good food for bacteria, if you have a bacterial infection, it very quickly passes till the end of the tendon sheath. Then this segment is very difficult to pass, so it stops the infection for a while. If you get the infection on the little finger, they easily pass to this area and makes a very bad consequences. Here in the back side of the hand we have 6 tendon compartments you will study in the dissecting room, and also here you can show a sample how the tendon is led by the tendon sheaths to make it possible to bend our fingers. Also we have tendon sheaths among others on the foot. We have a separate set for the extensors, for the peroneal muscle, and also for the flexors. Bursas is the next set of 8 in this area. These are flat bowl-shaped structure, fully closed, and inside also we have a kind of synovial fluid, the same slippery fluid as in the joints. The function of that is protection against heat. For instance, on this area where it's sensitive area, we must be protected against heat, against pressure, and also against friction. Whenever the tendon is sliding in the vicinity of the bone, it makes a kind of things. Looks like if you have a partially inflated ball and you can easily move your hand on each other. When you put down, it's much more difficult, so this kind of friction reduction is done by the bursas. Now, that was the brief introduction on the fascias and the muscles and the related structures. On the other structures, the vessels and the nerves, I will talk about in the next lecture. Now I give you a kind of introduction, how to find the structure, how to dissect, and how to describe an area. As I mentioned, the body is separated into specific areas. This is what we region. Let me give a certain a couple of information how to describe a region. The first thing, which unfortunately students forget, it's very easy otherwise, is the name of the region. This is what you have to start with. The next thing, you have to identify where is it. So you have to get a border of this particular region. So you have to describe palpable structure like medial epicondyle, lateral epicondyle, and so on, and draw lines in between them. So you will state where the region is. This is the key, is our palpable structures. The next is a skin innervation. Before you talk about what's below the skin, where you remove the skin, you have to talk about the skin innervation. So this area is innervated, that nerve like cutaneous antebrachium, medialis and so on, lateralis and so on. So you have to describe and a couple of informations on this particular nerve. Then next step is to remove the skin, and you have to talk about the superficial structures. This is what I mentioned before. Especially we have veins and nerves, almost all area. And some of the skin nerves which are responsible for the skin innervation are not dissectable. They are so tiny they cannot be dissected, but some of them very well dissectable. This is what we have to talk about once again when you describe this area. Skin muscles, as I mentioned, is very rare. The next step is to describe the structure of the fascia. This is what I mentioned before, or describe in details, separates compartments, separates muscle groups, and this is why the structure of the fascia is a certain kind of introduction for the next chapter of the region description. So we have to describe where the superficial lamina, if exists deep lamina, if exists septum, and name the muscle groups, whatever is separated by the fascia. Finally, you start describing muscle groups one by one. In each muscle group, first you have to talk about the muscles, name the muscles, talk about, describe the origin, the insertion, the function. Important thing, the function always moves joints, not the limbs and whatever. You always have to talk about the joints, refer to joints, and also you have to mention the nerve, the innervation. So whenever you describe the joint, you do not say that it lifts the arm, that it makes an abduction in the shoulder joint along the sagittal axis, or anteflexion in the shoulder joints along the transverse axis, or inward rotation in the shoulder joint along the vertical axis, and so on and so on. So whenever they describe the function of the muscle, you always have to refer to a certain joint and a certain specific movement along an axis. And finally, as I mentioned, you have to describe the structures. So the structures are the vessels, arteries, veins, nerves, and also the lymph nodes, well, if it's dissectable there. Now, finally, I like to mention a couple of information on the dissection, technical information. First of all, you have to get your own lab coat. You must have a white lab coat, if it's possible, always clean and tidy. And this is for protecting your clothes. And this is why we require, when you enter the room, it's already have your coat on and all bottomed up. You have to get some instruments also you have to buy yourself. One of the instruments is an anatomical forceps. This is about this size of instruments, and very important to see that it has a very fine serration at the end. This is the anatomical forceps. This one, which has hooks on that, the surgical forceps, must not be brought into the dissecting room because you can destroy structures with it. This is how can you hold the forceps, like the pencil. This is what you can make a very nice, gentle job. During the dissection, it's not the force, but the dexterity, whatever is concerned, and this way you can be more skillful. This way is practically you cannot use it properly. The next thing is you have to get a scalpel. The scalpel, usually we have a scalpel with removable hand. We have a handle of a scalpel and the blade of a scalpel. The blade of a scalpel is very sharp, and in contrary of your first feeling, the sharper the blade is, the less probably you destroy structures. If the blade is sharp, you just hardly touch it, and whatever is necessary to cut, you can cut it, but all the structures, when you touch it, move away a little bit from that. So it's very little possibility that you destroy structures. If the blade is dull, you have to force it, and when you force the blade, in this case, you have a good possibility to destroy structures. The sharpness of the blade is worn up quite fast. If you are not experienced, and once you touch with your try to clean your forceps with the sharp part of the blade, you usually have to do the head back. If you do that, you immediately can discard the blade because it's not usable anymore with a single movement. Also, if put it on the table, metal table, with the sharp edge first, then it will be dull very soon. As a rule of thumb, when you're a beginner dissector, you need a new blade about every 20 minutes. If you are experienced, usually a blade lasts for one full practice, but practically no more. Also, obey the rules where to discard the blade, because this disposal of the blade can be also very harmful for the garbage collectors. Sometimes you can, but the scalpel must be used also this way, like a pencil. You can do the most delicate job with that. Sometimes, very rarely, when you need very forceful things like cutting a strong tendon, you can use this one, but not regularly, because this way you can easily cut small, delicate structures. Important thing is the safety. This scalpel is very dangerous, and you can even kill people unintentionally. So you must to handle it very carefully. Most important thing is it must be always in front of your eyesight. So it's either this way or put down the table, but never beside that, and especially not up and not watching that, because you can really damage people. As a teacher, I was also cut 5 or 6 times by the students, even they were very gentle, and I saw this is also happens in some of the dissecting rooms whenever the students were negligent. So be very careful with that. Finally, it's very important, the behavior. The cadavers are human volunteers who offered their body for medical training. We must honor them as human beings. So we have to behave ourselves in a way what is necessary for give the full honor of a human people. Consequently, any kind of childish or jokey behavior in the dissecting room is not tolerated. Finally, I want to give you a kind of practical show on how to dissect. This is, I will give you some hints. The first thing is to feel the borderline of the structure. I will show you how to assemble the blade. So you get with one of your hand the blade and handle the blade. Be careful, we have an oblique cut, it must have the same location as the blade. Removal is even more tedious. Lift with your finger and push down on the other finger, then you can remove it. If you try to remove the blade with forceps, you can have it broken, and this is will kill your or damage your eye or so on. The first cut is done along the borderlines of the region, and you have to get a proper depth. If this too deep, you can damage the structure below, so this is why you have to be very careful. Below the skin, we have a loose connective tissue, which is a fiber web-like structure, and this is what you have to cut before. You do not scratch like a hand, but with a nice, slow movement, continuous movement, this is the best way to remove the skin. So once again, with the forceps, you must relatively forcefully pull, and the cut should be a very gentle, nice. This case, if you happen to have some structure below, the structure will slip away and you cannot cut it. Here you can see how it's done in a larger area. Below the skin, we have a layer of fat. Luckily enough, in this particular cadaver, the fat is minimal. Sometimes you have 2-3 finger widths fat. Probably you know now the people, everyday people who has very similar things. Here you can see a continuous way. The inner side of the skin, you have to see the hair follicles. If this is the job is tough, you can use the hooks which is present in the dissecting room this way, and this way it makes you easier to pull if you get tired, to pull larger quantities of skin. If this part of the hook is fit, your finger fit here, it will not hurt you, but you have to be very careful when you do this type of trick. Whenever the skin is separated from the underlying fat tissue, you will remove this fat. Once again, here is very lucky thing because it's a very thin one. So we separate the fat layer from the underlying muscle and the fascia which covering the muscle. The technique of the dissection is identical. You have to use it forcefully, and if you see this fiber web-like connective tissue, you know that you are in a good layer, so you have a minimal chance to destroy something, because very gentle way you can touch with the scapula blade and do that. The next layer is to remove the fascia from the muscle. You always have to cut parallel move your scalpel parallel to the muscle fibers. In this case, you get a very nice preparation. If you move this way, you can get scratches on the muscle and it will be looking ugly. You can see this is a good looking muscle. Whenever you remove the fascia, you have to take care to remove as big fascia as possible at one, because if you have little islands, it's a very tedious job to remove it, so much bigger job. Consequently, whenever you move the fascia, try to move as big a layer as it possible as a single stretch. Practically, this is what I want to show you as an introduction for the dissection, and the video will end soon. This video, by the way, is visible on our internet site in the chapter of notes or handouts. This is the title of that. This is what I wanted to talk about today, and the next lecture we continue with the description of the structures, arteries, veins, nerves, and lymphatic vessels. Thank you for your attention.